Today we are going to speak about cataract in vet medicine. So what is a cataract? Cataract is the clouding of the lens. The lens is a normally transparent structure located behind the iris that allows us to see clearly both near and far thanks to the process of accommodation. As the lens gradually loses its transparency, vision becomes increasingly blurry until the animal may become completely blind. How to recognize a cataract? In the early stages, it can be difficult for an untrained eye to detect cataract in an animal. The loss of clarity usually progresses slowly and the pupil gradually becomes opaque, changing from black to white or bluish. If you are unsure, your regular vet can confirm the presence of a cataract and refer you to an eye specialist. What are the consequences of a cataract? Cataract affects vision. Once established, it leads to a decrease in visual acuity. Animals may hesitate when moving in unfamiliar environments, bump into objects, or even fail to recognize familiar people. As it progresses, cataract can cause changes in the eye that may lead to serious, sometimes painful and irreversible complications such as glaucoma, lens luxation, or retinal detachment. What can be done about cataract? There is no effective medical treatment to reverse a cataract. The only treatment is surgical, both in humans and animals. The procedure involves restoring the eye's transparency by replacing the cloudy lens with an artificial one called an implant. This is done through a minimally invasive surgery using an operating microscope via an incision smaller than 3 mm. In vet ophthalmology, we use the same equipment and techniques as in human medicine. However, the surgery must be performed under general anesthesia. The implants used are species-specific: dog, cat, horse, rabbit, with adapted sizes and properties. Who can operate? In human medicine, ophthalmologists perform cataract surgery. In vet medicine, the procedure must be performed by a vet ophthalmologist. Ideally, they should be a certified specialist, only about 20 in France, or hold a qualification such as DE or CES with specific training in cataract surgery. It is a delicate procedure that requires skill and experience. The surgical environment is equally important. The operating room must be equipped with advanced microsurgical tools and allow for close monitoring of anesthesia. The medical team must be trained and available to monitor the patient closely during and after the surgery. In dogs, intraocular pressure must be monitored for 24 hours post-op. This is why dogs are usually kept in hospital during this period, helping to prevent complications. What are the results? The results of cataract surgery in dogs are excellent, with a success rate of 95%. However, complications such as glaucoma or retinal detachment can occur, especially if the surgery is delayed. This is why early intervention is strongly recommended. After surgery, animals often regain mobility and return to normal activities. Their quality of life improves significantly for their family's happiness and the veterinary team's satisfaction.